Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today, Nassar Nizami joins us, and we have a phenomenal conversation. He's the CIO for Jefferson Health. It's very quick. I caught him in between meetings. We got about a half hour together, but we talk a lot of things. We talk priorities. We talk about the impact of COVID on health IT, the impact of COVID on the community that they serve. We talk health disparities, a lot of great topics. He's a great guest. You know, somebody sent me a note and said, hey, how can we help out the podcast? There's two great ways you can help out the podcast. One is just shoot a note to a friend and tell them that you're getting a lot of benefit out of the show and that they should really subscribe to it. But another way you can really help us out is by, whatever app you're listening to the podcast on, go ahead and click and give us a review. Tell people about the value that you're getting from the show. We would really appreciate it. It helps us. It moves us up in the rankings in Apple and in Google and in the other services as well. And doesn't take that long, and we really appreciate it. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. Just a quick note before we get to our show. We launched a new podcast, Today in Health IT. We look at one story every weekday morning, and we break it down from a health IT perspective. You can subscribe wherever you listen to podcasts at Apple, Google, Spotify, Stitcher, Overcast, you name it, we're out there. You can also go to todayinhealthit.com. And now on to today's show. All right, today we are joined by a friend of the show, Nassar Nizami, who's CIO for Jefferson Health. Good afternoon, Nassar. Welcome back to the show.
Good afternoon, Bill. It's always a pleasure. Thank you for inviting me again.
Yeah, I'm looking forward to the conversation. There's, so much going on. I really appreciate your time. But this is the first time we're talking in 2021. So give us a little background on Jefferson Health, what markets you guys serve and some of the things you guys are doing.
Sure. So Jefferson Health is about $5.5 billion academic and community health system with 14 hospitals, a long-term care facility, and a robust outpatient network. We serve communities in Philadelphia metro area and southern New Jersey. We have about 35,000 employees. As a health system, we have been exponentially growing for several years now. And as a reference to your audience, Jefferson was a 3-hospital, $1.5 billion organization in 2014. We have more than tripled in a matter of 6 or 7 years, both growing organically and through a series of mergers, acquisitions, and partnerships.
Yeah, so this is one of those things that happens when you do the podcast towards the end of the day and we record. I get kind of like, oh, so you haven't been busy since then, right? So not much IT work as a result of growing that fast.
Just a few things.
Yeah, I would imagine. Well, hey, I got the opportunity to hear Dr. Klasko. He presented at the JP Morgan conference, and he was, electric as always, just electrifying in his presentation. He presented a vision of how Jefferson would address this pandemic in 2030. And I love how he does that. He sort of fast forwards and he says, okay, it's 2030 and here's what we have. And he talked about 3D printers printing PPE. He talked about bots, and he talked about bots IDing the illness, wearables that test for cases, drones that deliver medications, virtual work that limits the spread. When these things get developed, how do they, when he develops these kinds of visions, and I assume he does it with a group, how do they inform the work that you're going to be doing at Jefferson?
It's a privilege to be working for a futurist like Dr. Klasko, and it's hard to match his imagination, but I'll share a few things. Like some of the things that are futuristic, but I think are not that too far in future. For instance, we know that last year Amazon got FAA approval to operate in its fleet of Premier drones. And last year, CVS partnered with UPS to deliver medication to senior citizens living in the villages in Florida, right? Some of the things like you mentioned, and Dr. Klasko mentioned, virtual work, will limit the spread of virus. We already experienced that. We, Jefferson, like many other organizations, successfully moved thousands of users and thousands of students to work in study remotely in a matter of days. It's a combination of things. I think when we discuss and we think about future, my team's job is to understand the business we are in, understand the role of technology, understand Dr. Leader's vision, like Dr. Klasko's vision, in general, to stay a few steps ahead of where the industry is going to be, so we can move Jefferson accordingly in
Right.
place.
And you really have a choice. You can work for someone like that, Dr. Klasko, who is a visionary and out there, or you can work for somebody that you have to bring along. And as a CIO, and it is really a privilege to work with somebody who's really pulling you a little bit and saying, hey, this is where we're going in this city. Let's go there together. So it's kind of fun. He shared some numbers at Jefferson. You guys had zero transmission to non-COVID patients and less than 1% infection, 1% employee infection rate, and those are fantastic numbers. How did technology play a role in your COVID response at Jefferson?
Look, first of all, I'm very proud to be part of Jefferson and proud of what team has achieved. I must say that everything starts with a focus and mission. Things like COVID happens once in a lifetime, and if you're not clear about the mission, then it's very difficult to come up with any plans. And early on, when COVID hit us, we looked at our mission and says, look, our mission is to improve lives. We need to do the right thing. And from a technology perspective, that enabled myself and my team to focus on our core competency, which is ability to execute. We had all the right ingredients. We had the trust by our operational colleagues. We had the technical expertise, clear communication channels, and the ability for even a junior person in our team to make the right decision. So our motto was, hey, decide, communicate, and execute. Even if you're an analyst and you have to deliver a laptop to someone who decides that they're going to be working virtually. So, and look, a few things that we did quickly that resulted in the numbers you mentioned. We pivoted to work from home very quickly, right? This is partly because we were in the cloud for some of the key applications used by back office workforce. We had collaboration tools already, like email, etc., budgeting systems already in the cloud. Secondly, we were very quickly able to stop things that were not critical for COVID. And very quick decision, again, making played a key role, because early on, if you think about February and early March, it was very unclear how things are going to unfold. We were able to stand up sites, bring up equipment in partnership with like City of Philadelphia, et cetera, and third-party organization. We immediately, very quickly enabled remote monitoring for patients who were in our hospitals in the bed. So the exposure of our clinical staff was limited to the patient. So a number of steps in technology's ability, especially collaboration tools, telehealth played a key role. Our ability to pivot to work from home very quickly. I mentioned the presence of cloud, played a key role. But at the core of it really was, everyone's, understanding of what our mission is and how we are going to be making decision, whether it's a small decision or a large decision.
It's interesting. Several interviews we've done with you, and even with you and Dr. Klasko, you guys talked a lot about the healthcare without an address, or I forget the terminology, but it was essentially, you guys have really been preparing for this for a long time. It's not like COVID hit and you're like, oh gosh, we've got to implement all this technology so that we can work remotely. I mean, this has been a path that you were on, and probably just like a lot of others, COVID just accelerated the use and adoption of a lot of those technologies, I would imagine.
You're absolutely right. Jefferson, Dr. Klasko, and myself, we are big believers in healthcare. What we call healthcare without address. Jefferson at home is another term that we use. We invested in telehealth several years ago, and there were a few health systems that were investing in telehealth in a big way, in a significant way, which frankly paid off dividends. We invested in some of the technologies when it was difficult to, make a case for an ROI, right? Even simple things that seems reasonable now. Our investment in cloud, for example, decisions that we were able to make because of the right leadership, because of clarity, regardless of COVID or no COVID. Hospital at home, hospital without an address is the future that we believe in, and you probably have heard Dr. Klasko talk about sick care versus health assurance. This has been part of the mantra way before COVID. So you're absolutely right. We were already on a journey, and COVID just accelerated it probably by, I don't know, 10 times.
Yeah, it's amazing the adoption rates both in the community amongst the clinicians and to be honest, I mean it pulled us in some directions because from an IT perspective, I'm not sure any of us anticipated sending the finance team home to work from home. That's not a team or supply chain and whatnot. Those have traditionally been in the office kinds of teams, but when COVID first hit, it was it's just a different model.
Look, I mean, one of the proud moments for me was when we all went home. We were not sure about the productivity, etc. But I think 2 months or 3 months into COVID, like this is June or May or June timeframe, our CFO basically said, "Look, we have been remote, and I have not seen any loss of productivity." And this is a person who is not a believer in remote work, and now he's a believer. I mean, almost 12 months after we went work from home, our productivity levels are still very high working remotely.
Yeah, it's you're sort of at a disadvantage here because I got to hear your CEO, and I'm like, okay, your CEO said this. What do you do? I'm going to do that.
I know.
But there was a lot of talk about health disparities at the JP Morgan conference, and Jefferson was one of those systems that talked pretty strongly on the topic. And I think the quote I picked up was, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I guess the question around this is how can technology play a role in addressing health disparities in a community like Philadelphia?
Look, I think there is an opportunity for technology to play a significant role. So at the same time, I worry about digital divide as well, right? I'll give you one example. That the need for access to broadband services became glaringly obvious during COVID, right? We saw exponential increase in the use of telehealth services, and it's something to be celebrated. And health systems across the nation, saw an increase, and it's just amazing thing to happen. But in order to have a successful telehealth visit, you need at least a mobile phone or desktop, right, in a working broadband connection. And not everyone have a robust broadband connection. Not everyone have a working device at home. It's very difficult to e-check in if your computer is broken, have virus, or is just slow processing wise. If you don't have proper broadband connection and you're relying on some connection that often fails, 20% of our telehealth as a point of reference fail because of some issue at the endpoint. Okay, so to me, it highlighted the need of robust broadband connection, which generally speaking, you don't think as related to healthcare. It's just, hey, internet connection. But it is, yeah, and has become a very key way, and especially when we think about hospital at home and sick care at home and Jefferson without address, this is just significantly important. Without a robust connection and without access to digital tools, there will continue to be a divide. And frankly, I think that there is a part of where I think that government can play a role in regulating broadband connection. And in my mind, frankly, we have to start treating broadband as a utility. Power, water is no longer a luxury. And similarly, to access to digital devices for underserved population. With these things, I think we can really cut through the big issues of access and affordability with the help of digital, right? We really have an opportunity to reach a population which otherwise don't have access to healthcare facilities, right? And we can help them in their homes, wherever they are, and in a very affordable way. I mean, telehealth makes everything very affordable. Now, on the other side of things, like, look, I mean, there is a lot of promise for technologies like AI and machine learning. I was discussing with our chair of radiology the ability for AI to read through X-rays in perhaps under privileged communities in some developing countries, the ability for AI to flag things like X-rays or CTs and help in an area where there are just not specialists, there are not radiologists available, right? So I think that there's enormous potential, and technology can certainly play a role in addressing health disparities in a community like Philadelphia and beyond. But there are some very important and difficult questions that we need to answer in terms of access and affordability around digital technologies, broadband access in particular.
Yeah, you know that was actually one of my predictions for 2021 coming into this year is around the digital divide, and I think it got so accentuated, I guess is the right word, last year because it wasn't only healthcare, it was education. You have kids trying to go to school and they don't have broadband. I mean, think of how silly this is. They're trying to go to school remotely and they don't have broadband, let alone a computer device. And it's not like those computer devices are all that expensive these days, and their next door neighbor has broadband. So it's like, you know, we've got to. This is not rocket science. This is probably one of those things that, you know, this year I think comes to the fore, and you know, to not have broadband in 2021 is a significant barrier. I don't know how I even look for a job if I can't get on the internet, if I can't go to a public place to get on a computer and the public place that has a computer is closed down because I can't go sit inside. I mean, just all those things, but we just didn't anticipate them. And I think they're all front and center now.
Well said. Look, I mean, you hit it on the head. The issues you mentioned around education, absolutely. I mean, this is something I experienced with my kids as well. Like, and you spoke about, we are fortunate to have broadband, but in areas, I know of areas where my team members have only one broadband carrier, right? So no choice. And during pandemic, the service was just, you know, very poor, and there was no choice, right? So it just highlighted the need to rethink about our nation's investment in broadband infrastructure. You're absolutely right.
Yeah. Well, let's talk about priorities, and then I want to come back to, you know, what are the lessons learned. So at this point in the pandemic, but let's talk about priorities. What are the technology priorities going into 2021?
So look, I think hopefully we are towards the end of pandemic. You know, our numbers are decreasing, so I would say we are still very focused on COVID. Okay, I think our focus now has changed, turned from, you know, inpatient and more patients coming to the hospital to now how do we vaccinate. So we are spending weekends, evenings on mass vaccination, right? So, and the needs are different. So we are focused immediate future on how do we register our patient in a reasonable way, in a safe way. How do we reach the populations, you know, electronically? So obviously, you think again, this goes back to our discussion of a digital divide, because you think about, you know, the best way to register and then vaccinate. You know, if we have access to portal, we sign up on the portal, pick a date, and we will schedule in next 2 weeks from now. This is fantastic and ideal way. Fortunately, we have technology to make that happen, but not everyone has technology at their homes, and not everyone have access to it. So our priority immediately from a technology perspective is to make sure that we help not only Jefferson, but also city of Philadelphia in southern Jersey, public vaccination. I think a big you know, area of investment, hopefully in the later part of 21 for us, is going to be on digital technologies. We were forced in a way to work from home and rely on a lot of virtual services. I think almost a year into it, we are thinking that this is going to be really permanent. I mean, it's quite possible that we are staying in some sort of a hybrid format. I'm very certain that it's going to be. We are not going back to our old ways. That I can share with certainty. So some of our work is going to be just around that. How do we cement, you know, work from home? Some of the, for instance, technologies that are not cloud-based that require things like VPN access that, you know, works if you work like 1 or 2 days a week. from home. But if you are doing your job and you're relying on, services and old systems that are still hosted in our data center, it becomes problematic. So continued move to cloud, continued investment in digital. I think that there is a huge opportunity in improving, at least at Jefferson, and I think in general healthcare, what I think the common word I think is probably overused is digital front door. So there is going to be a big push, already is, but I think even more significantly, we are going to be pushing more towards digital front door. Automation is a huge priority. We kicked it off last year. We slowed down because of COVID. I think that that's going to be a big push in later part of 21. We are still sort of towards tail end of our implementation of EHR in some of our hospitals. So one EHR, we are fortunate that we'll have one EHR across our health system. That's something that's ongoing, and I'm looking forward to complete it. So a number of initiatives, but if I were to sum it up in one word, I would say digital.
Yeah, digital. Absolutely. That would make sense. You did touch on this a little bit. The major systems, the EHR, PACS, ERP, CRM. You have a one EHR initiative because you guys grew through several acquisitions and whatnot. So you're still in the midst of that one EHR. What about the other major systems?
So we were fortunate that in the last few years, we as an organization made a decision that as a health system, we have one operating model, and it's going to be a centralized operating model. We are not going to operate as a holding company, and therefore, which basically educated us and informed our decision to say, like, if we are going to operate as one company, we really need centralized systems, and ERP, HCM, payroll were one of the first systems that we started standardizing and centralizing on. EMR standardization came a little bit later, which I'm glad that in a few months we'll be done with it. Same is with PACS. We standardize off one version of PACS across the health systems, and this is all result of our philosophy that we are going to. There is value in economies of scale. There is value in standardization of care, especially in the areas that are tried and trusted. People know there is innovation happens in all forms, but today mostly I would say that it doesn't matter what EMR you're using, any organization is using. It doesn't matter what PACS you're using, as long as it's like one of the scalable ones. I wouldn't name any names, but I think it's more important to have one standard system and processes and protocols that go along with it than a mishmash of systems. And I have lived both lives, and my colleagues in operations have lived that life, and we all agree that a standardized, aligned way of work is way better than working in, believe it or not, 9 different EMRs. That we lived through that.
Well, I have 2 closing questions. I appreciate your time. We squeezed it in here. You've got a lot of stuff going on. I want one question is going to be sort of looking back, and one's going to be looking forward. And the one looking back is we're sort of hopefully beyond the midway point of the pandemic. What lessons have you learned as a health system CIO?
Look, I think the most important lesson I think for me is the nimbleness and ability to make quick decisions was just amazing. Countless times our teams faced an issue without calling themselves tiger teams or any other fancy names. Individuals got together, discussed the issue, came up with a solution, and implemented it. Right? It was just a amazing process, right? Which basically, and this happened at all levels of organization. It happened at leadership level, it happened at the mid leadership level, it happened at analyst level, right? And which told me that our prior to COVID, if you had asked me, I would say, health systems tend to be bureaucratic, especially if you're in an academic medical center. It takes months and months, sometimes years, for us to make decisions, simple decisions like standardizations or a product, etc. And frankly, what lesson learned for me, one of the biggest lessons learned for me is, that look, we can operate in a very nimble way, almost like a startup, And how a question for us, frankly, is how do we preserve that? Because we were forced into this situation where we had to act a certain way. We acted, and I think we were incredibly successful. How do we preserve that nimbleness, the trust that we have created among each other, the whole mantra of decide, communicate, and execute? We just need to move it forward.
Yeah, and that's, it's interesting because that's one of the hardest things as a leader is to get that momentum going. And the silver lining of the crisis was it was the impetus, it was the momentum, and it did prove we could do things we never thought possible, which was pretty amazing. I guess the closing question is, what do you think the lasting impact of COVID is going to be on health IT specifically?
Look, I think it's going to be cultural, the change in thinking around technology, right? And the changes that would have happened anyway over the next 5, 7, 8, 10 years that happened within, let's say, 10, 12 months. So the acceptance of technology as a key enabler of healthcare, especially in the realm of digital telehealth, just accept the cultural change where it is very accepted now to work from home, or ability to hire people in remotely and allow them to work remotely, I think is going to be big. And generally, the trust that patients experienced using digital technologies in certain populations where historically we thought of a not as technology savvy or won't trust technology as much, and some of the segments of population that trusted technology and used technology and have, I think, forever changed is just amazing. And I think that will be the lasting impact of COVID, around the culture change within IT teams that work at Jefferson and I think across the nation, and then the population that we serve, both our colleagues in operations and how they use and see technology, and equally important, the students and the patients that we serve, their acceptance and use of technology, I think, have radically changed. And I think we are not going back, as I said earlier in the interview. We are not going back.
We're not going back. Nassar, thank you for your time. I really appreciate it. Always a pleasure to sit down with you.
It's my pleasure. Thanks for having me.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.